everybody! Today we'll be going over some pharmacy updates for the month of May. Today we will be talking about 6 different news items. The first being new indication for dapagliflozin for heart failure, osteoporosis guidance during COVID-19, potential severe asthma exacerbation drug masitinib, which currently has no brand name, DOACs versus warfarin in AFib patients and its association with osteoporotic fracture risk, trifarotene Acleaf cream approved by the FDA, and Phexxi, the first non-hormonal contraceptive approved by the FDA. First, we'll be going over the DAPA-HF trial, dapagliflozin in patients with heart failure and reduced ejection fraction, published in November 21st of 2019. The purpose of this study was to evaluate the efficacy and safety of SGLT2 inhibitors, specifically dapagliflozin in patients with heart failure and reduced ejection fraction regardless of having diabetes or not. The study looked at less than 5,000 patients who underwent randomization, and you can see the exclusion criteria there. The 2 study arms were between dapagliflozin 10 mg daily versus placebo. Typically, dapagliflozin's normal initial dose is 5 mg, and then is titrated up to 10 mg, but here they started off at 10 mg. There was a composite outcome comprising of worsening of heart failure or death from cardiovascular causes. Worsening of heart failure was defined as unplanned hospitalizations or having an urgent care visit that warranted IV therapy. Listed are the individual components of the primary outcomes. Overall composite of primary outcome was less in the dapagliflozin group compared to placebo. We cannot single out which component drove these results as they were all significant. One thing to note is that urgent heart failure visits were almost cut in half using dapagliflozin. Though the number is small, this would add to the positive benefits of using dapagliflozin in heart failure patients. Here is a visual representation of the primary outcome of worsening of heart failure or death from CV causes. The blue line shows that there was a statistically significant reduction with using dapagliflozin daily, with a number needed to treat of 21. In conclusion, the DAPA-HF trial showed that adding dapagliflozin to the patient's daily regimen had cardiovascular benefits in patients without diabetes. This agent is safe and effective to use in patients with heart failure, thus expanding its therapeutic role. Next, we will look at some release guidelines on managing osteoporosis. Many reputable organizations and societies came together to create a joint guidance which will provide practitioners with strategies to manage osteoporosis during this pandemic. There are 8 total points to consider for patients. The first 4 are listed here. 1. Initiation of oral bisphosphonate therapy should not be delayed for patients at high risk for fracture. 2. Patients who are already receiving osteoporosis medications should continue treatment when it is safe to do so. 3. BMD exams may need to be delayed. 4. Standard pretreatment lab measures for IV bisphosphonates or denosumab can be skipped if results within preceding year were normal. 5. Consider alternative methods of delivering parenteral osteoporosis medications. 6. For patients who are unable to receive their prescribed regimen of denosumab, consider a delay in treatment. 7. For patients who are unable to receive their prescribed regimen of teriparatide, abaloparatide, or romosozumab, consider a delay in treatment. 8. For patients who are unable to receive their prescribed regimen of IV bisphosphonates, treatment can be delayed. Next, we will talk about a Phase 3 study that was meant to be presented at the American Thoracic Society International Conference. However, it was canceled due to COVID. Masitinib is a tyrosine kinase inhibitor that was shown to decrease asthma exacerbations for those that have severe asthma and was uncontrolled on their oral corticosteroid. The purpose of this study was to evaluate the efficacy and safety of masitinib in severe persistent asthma patients that is uncontrolled with oral corticosteroids. The study looked at 420 patients with severe asthma treated with an oral corticosteroid, and you can see the exclusion criteria there. The 2 study arms were between masitinib 6 mg per kg per day versus placebo. There was a composite outcome comprising of the reduction in the annualized severe asthma exacerbation rate for overall exposure. Severe exacerbation was defined as worsening asthma causing hospitalization or an increase from stable corticosteroid maintenance dose for greater than 3 days. There are other biologics available in the market having different or similar mechanisms of actions, but masitinib would be targeting a different pathway. Results from the study showed that compared with placebo, treatments with masitinib was associated with a significantly reduced severe asthma exacerbation rate of 35%. Investigators concluded that this medication had a positive benefit-risk ratio over a sustained period and that it could provide a new treatment option in severe asthma. Next, we will look at the association between treatment with apixaban, dabigatran, rivaroxaban, or warfarin, and risk for osteoporotic fractures among patients with atrial fibrillation. This was a population-based cohort study mostly done in Hong Kong. The purpose of this study was to compare the risk of osteoporotic fracture between anticoagulants. The study looked at around 23,500 patients who were newly diagnosed with atrial fibrillation and were prescribed a new anticoagulant of interest. And you can see the exclusion criteria there. The two study arms were between DOACs of interest versus placebo. The DOACs of interest were dabigatran, apixaban, and rivaroxaban. There was a composite outcome comprising of hip and vertebral fractures, which were identified using ICD-9 CM codes. Here is a table showing the baseline characteristics of the study participants. Around 50% were women. Note that some participants were on agents that are associated with increased risk of fractures. For example, PPIs and systemic glucocorticoids. Though the study was mostly conducted in Hong Kong, when compared to other similar studies, the results yielded were similar. This graphical representation shows that the use of DOACs had less osteoporotic fracture incidences compared to warfarin. You can start to see the gap widen a little before 6 months and continues to widen after the 12-month mark. For the outcomes, there is a statistically significant difference between the osteoporotic risk between the DOACs of interest when individually compared to warfarin. However, in a head-to-head comparison between the DOACs, there is no statistical significant difference between the individual agents. In conclusion, in patients with AFib, DOACs were shown to have lower risk of osteoporotic fractures. This gives another reason to favor DOACs in AFib treatment. Additionally, there were no difference observed choosing between the three DOACs, dabigatran, rivaroxaban, and apixaban. Next, we'll briefly talk about a new approval from the FDA. They just approved of a new topical retinoid cream called Trifarotene. The study conducted showed its safety, efficacy, and cutaneous tolerability for moderate to severe acne. There were shown benefits on reducing facial and truncal acne. However, one thing to note is that there are no current active head-to-head trials comparing the new agent to standard acne treatments. Topical retinoids are typically the go-to treatment for acne along with benzoyl peroxide. While Trifarotene is a new product to be considered, there are similar products like adapalene, tazarotene, and tretinoin that have been on the market for acne treatment. Next, we'll look at another drug that was recently approved by the FDA. Phexxi is the first non-hormonal contraceptive that consists of lactic acid, citric acid, and potassium bitartrate. Essentially, what it does is keep the acidic environment, which is unfavorable for the sperm. Phexxi is a vaginal gel pre-filled in an applicator to be used at most an hour before or right before intercourse. It is 86% effective in preventing pregnancies, so it is best to utilize it with something and not by itself. Phexxi is safe to use with available hormonal contraceptives, but it should be avoided in women who use vaginal rings. To recap, dapagliflozin now has a new indication as a heart failure drug as it portrays CV benefits in patients without diabetes. A guidance for osteoporosis management during COVID-19 quarantine was created to help primary care physicians and their patients. Essentially, it tells you when to hold therapy or switch therapy to oral bisphosphonates. Masitinib, which has no brand name, showed beneficial effects for patients having a severe asthma exacerbation while on a corticosteroid. In patients with AFib, when comparing warfarin to the three DOACs, apixaban, rivaroxaban, and dabigatran, it showed that there was less osteoporotic fracture risk in the DOAC group, which will help guide choice of anticoagulants. Trifarotene cream is a new topical retinoid for the treatment of moderate to severe acne, but no head-to-head comparisons have been made between current topical retinoids. Phexxi is a new contraceptive used before intercourse that consists of lactic acid, citric acid, and potassium bitartrate to help in preventing pregnancies by manipulating the pH environment.